Fourth phase of nationwide lockdown begins today with substantial relaxations. States, union territories asked not to dilute restrictions imposed by Ministry of Home Affairs. India sees a record jump of 5,242 cases of coronavirus in the last 24 hours. Death toll due to COVID-19 rise to 3,029 and the number of cases to 96,169. Active COVID-19 cases stand at 56,316 with 36,823 recoveries. Assam records 2 more COVID-19 cases today, taking the tally to 104. And 62 countries, including India, have backed a joint effort by Australia and European Union calling for an independent inquiry into the WHO's response to the COVID-19 pandemic. Hello viewers, welcome to News and Trends, and you're watching the Daily News Bulletin. We begin this bulletin by taking a look at the latest update on COVID-19 from across the country. The death toll due to COVID-19 rose to 3,029 and the number of cases to 96,169 in the country today, registering an increase of 157 deaths and a record jump of 5,242 cases in the last 24 hours, according to the Union Health Ministry. The number of active COVID-19 cases stood at 56,316, while 36,823 people have recovered and 1 patient had migrated, it said. A senior health ministry official said around 38.23% patients have recovered so far. The highest number of confirmed cases in the country are from Maharashtra at 33,053, followed by Gujarat at 11,379, Tamil Nadu at 11,224 and Delhi at 10,054. In the northeast, Tripura has reported 167 cases, Assam has 104, Meghalaya has registered 13 cases, Manipur has 7 cases, Mizoram and Arunachal Pradesh have reported a case each till now. In Assam, 2 more positive COVID-19 cases have been reported, taking the total to 104. The cases have been reported in Golaghat district. Taking stock of the situation, the State Health Minister Himanta Biswa Sarma tweeted, "Alert! 2 persons have tested COVID-19 in Golaghat." Assam's tally of death toll due to COVID-19 rose to 3 today, with the death of a 71-year-old man who returned from Mumbai and had neck cancer this morning at GMCH owing to respiratory distress. Of the 104 cases, 58 cases are active and 41 have been cured or discharged, while 3 have died. The 4th phase of nationwide lockdown has begun today. Union Home Ministry had yesterday extended the nationwide lockdown for 14 more days till 31st of this month. Nationwide lockdown since 25th March has helped considerably in containing the spread of COVID-19. The 4th phase of lockdown will, however, witness substantial relaxations than its previous versions. Government has allowed the states and union territories to demarcate red, orange and green zones. In the current phase of lockdown, states and union territories will be able to delineate districts, subdivisions or even municipalities into the 3 different zones based on parameters shared by the Union Health Ministry. This measure would help the states in extending the relaxations in larger parts. Home Ministry has put out a list of activities which will remain prohibited throughout the country till the next 14 days. All domestic and international air travel of passengers except for medical or security services shall remain prohibited even in the 4th phase of lockdown. Except for Shramik Special, few other special trains, parcel and freight trains, the railways as well will not resume its complete passenger operation. Metro trains too will have to wait in the fourth phase of lockdown. Schools, colleges, educational training, and coaching institutions will also remain shut nationwide. Cinema halls, gymnasiums, shopping malls, entertainment parks, or any other high gathering places will remain prohibited nationwide. Public gatherings of any kind, including political, social, and cultural congregations, will not be allowed anywhere as a measure of caution. Access to places of worship and religious gatherings as well remain strictly prohibited. Night curfew barring from essential work will continue to remain in force from 7 in the evening till 7 in the morning till 31st May. Other than the nationwide prohibited activities, state and union territories will decide on all other activities to be allowed in the three demarcated zones. They will also decide on resuming the intrastate bus and other vehicular services. As far as interstate movement of buses and vehicles is concerned, consent of both the concerned states will be necessary. Apart from these fresh relaxations which will allow majority of the shops to be opened up, government has also allowed opening up of sports complexes and stadiums. Spectators would however be not allowed at these places. Online and distance learning is permitted and steps will be taken to encourage it further. Home delivery of food items from restaurants will also continue as before. Government has also advised people above 65 years of age or with comorbidities, pregnant women and children below the age of 10 to stay at home till the lockdown is in place. The CBSE today released date sheet for Class 12th board examinations for the remaining papers. It also released date sheet for the rescheduled board examinations of Class 10th for Northeast Delhi. The examinations will be conducted between 1st of July to 15th of July this year. The CBSE has also issued instructions asking students to carry their own sanitizer bottles and wear masks and follow social distancing norms during the examinations. Parents will ensure that their ward is not sick. The Class 10th examinations were postponed due to violence in northeastern part of national capital, while Class 12th examinations in view of the lockdown imposed in the country to combat COVID-19. Nagaland Chief Secretary Temjin Toy today issued an order with partial modification of the standard operating procedure, whereby all persons entering the state from 18th May 2020 onwards, irrespective of the place of origin of journey, shall undergo 14 days of institutional quarantine at designated centers and thereafter proceed for 14 days mandatory home quarantine. Furthermore, the order stated that persons above the age of 60 years, children below the age of 10 years, parents and pregnant women and accompanying spouses shall be thoroughly screened and, on the advice of the medical team at the quarantine center, be sent for mandatory home quarantine for 28 days with active surveillance. However, the above modifications will not apply to persons who have already entered the state before 18th May 2020 from orange, green zones and have not crossed red zones en route to the state. All other provisions of the SOP shall continue to be in effect, the order stated. Worldwide, 47,30,323 people have coronavirus and 3,15,482 lakh people have died. The US, hardest hit by the coronavirus, has nearly 90,000 coronavirus deaths, according to the real-time tally by Johns Hopkins University. Followed by Russia with 2,90,678 cases, the UK with 2,44,995 cases, Brazil with 2,41,080 cases, Spain with 2,30,698 cases, Italy with 2,25,435 cases. In terms of death toll, the US is followed by the UK at 34,716, Italy at 31,763, and Spain at 27,563. Brazil has overtaken Spain and Italy to become the country with the fourth largest number of confirmed coronavirus infections in the world. Officials reported 14,919 new cases in the past 24 hours, taking the total to 2,33,142. Only the US, Russia, and the UK have higher numbers. The death toll in Brazil over 24 hours was 816, bringing the total to 15,633, the world's fifth highest figure. 62 countries, including India, have backed a joint effort by Australia and European Union calling for an independent inquiry into the WHO's response to the COVID-19 pandemic, according to a draft resolution proposed for 73rd World Health Assembly WHA meeting beginning today. The draft calls for impartial, independent and comprehensive probe into the coronavirus crisis, besides an inquiry into the actions of the World Health Organization WHO and their timelines pertaining to the COVID-19 pandemic. Last month, Australia was the first country to call for an independent inquiry into how the coronavirus outbreak started. Deputy Commissioner Dimapur Anup Kinchi today convened a meeting of Dimapur District Task Force members to discuss issues pertaining to COVID-19 in the conference hall of DC Dimapur. While observing that coronavirus would remain with us for a long time, Anup reiterated that following hand hygiene, wearing masks and maintaining social distance should be part of a lifestyle to defend the virus. In the meeting, it was decided that a meeting would be convened to resolve the Borlingri problem. DC Dimapur sought help from the civil societies and advised them to be prepared for arranging quarantine centers to help people. He said that the government was trying its best to enhance the capacity to take the returnees, but in case of emergency, the services of the civil societies would be required. In the meeting, all the civil societies, GBs, and all stakeholders committed to work collectively in the fight against the unseen virus. The Department of Health and Family Welfare has said that a total of 961 samples of suspected cases have been sent for testing from the state. The results of 914 samples have been received and all have tested negative. The results for the remaining 47 samples are awaited. In addition, a total of 25 samples have been tested by TrueNat and all are negative. A total of 2,967 persons have been screened and a total of 1,352 persons are presently under facility quarantine. Additional Director Animal Husbandry and Veterinary Services Dr. Bhuti Lama has informed that ban on import of pigs into Nagaland has been enforced with effect from 29 April 2020 due to outbreak of African swine fever disease in Assam and Arunachal Pradesh. In this regard, the village functionaries, public, consumers of Nagaland, especially districts of Dimapur, Wokha, Mon, Longland and Peren, which are bordering Assam and Arunachal Pradesh, have been requested to remain vigilant and refrain from importing smuggled live pigs and pork cuts from Assam, Arunachal Pradesh, as African swine fever disease is highly infectious with very high mortality rate up to 100%. At present, treatment and vaccine are not available and the only option is to cull, humans, slaughter and dispose the pig. It can wipe out the entire pig population in the outbreak area, colony, village, district, etc., causing huge economic losses. Principal Director School Education Shanawaz C has notified for the information of all concerned that due to change in a broadcast schedule effected by the All India Radio Kohima, the radio education program of the Department of School Education Nagaland will be broadcasted from 9:20 am to 12:20 pm with effect from 19th May 2020. However, the sequence of broadcasts of subjects for different classes will be the same as notified by the department on 4th May 2020. All DEOs, senior SDEOs, SDEOs have been hereby directed to disseminate details of the changes in the broadcast schedule to all heads of institutions under their jurisdiction through electronic media for further necessary action. And with that, we come to the end of this bulletin. Stay home, stay safe, and take good care of yourself. Bye for now, and thanks for watching.